All right, everybody. How are you tonight? Everybody doing good? You got your drinks? We are here at the Arizona Psychedelic Society, and tonight we are very pleased to introduce Dr. Sheldon Sullivan, who is going to talk to us a little bit about sleep. And then at the end, Troy will make a few announcements of things to come. Are you ready, sir?
Sure. Thank you. Appreciate you having me. Feel a little bit out of place because I've only tried psychedelics one time, and that was at my wife's. Talked me into it. It was pretty awesome. I was in Sedona, which is a great place to be, and I realized that I was on the same journey of life as this ant that I saw on the sidewalk, and I was connecting with the ant. It was pretty awesome. I grew up in a pretty conservative home, and so in my mind, that was like crazy. Anyone that would do mushrooms must be just a crazy person. But I've since learned that some of that dogma is not quite. And this gentleman walked in my office one day. It's not often when someone comes in your office and their beard is dyed like a mushroom. And somehow we just had this weird connection, didn't we?
We did.
Yeah. And so here I am. So I hope I don't bore you, but I think this is a topic that I'm passionate about. Let me just give you a little bit of
Can you
preface.
speak just a little closer into the microphone?
Yeah, I'm sorry.
That's okay, thank you.
I wanted to share an amazing breakthrough. So if I came in here with a bottle with something in it, and I said that I have a discovery that's a revolutionary, makes you live longer, enhances your memory, makes you more creative, makes you look more attractive, keeps you slim, and lowers food cravings, protects you from cancer and dementia, wards off cold and the flu. I don't know why it's doing that. It lowers your risk of heart attacks and stroke, not to mention diabetes. You'll feel happier, less depressed, and less anxious. How many would be interested in that?
Yep.
Okay? Well, we have it. It's called sleep. It's called good sleep. Okay? And that's really what this is about, because sleep is such an integral part of health and wellness that it's often overlooked in our society. It's not uncommon for me to have a gentleman in my practice, and he'll brag about how he only needs 4 hours of sleep. I'm like, well, that's just not how we're designed. That's not how it is. So I feel there's a lot of misinformation out there. Hopefully I can demystify some of this. Just a quick background about myself. I'm a restorative dentist. What that means is I do a lot of reconstructive work. So if someone's been in an accident, or they've lost their teeth, or they just want to have a more attractive smile, I often will go and I'll do this restorative work, and it leads me into a lot of really quite complex dentistry. So here's an example. This is a woman who grew up in Russia. She had a lot of tooth problems, and this is what we're able to do, this kind of stuff. So we call it a smile makeover. We try to make it look natural, but we try to give people back the quality of life. This is a gentleman who's a local physician. I want to point out something that we'll talk more about. If you look at that top picture, see how the teeth are chipped and worn? That's something that's going to become very topic worthy throughout this presentation. Another gentleman. Anyone know why that screen keeps flickering like that?
I don't know. Do you know?
Do you have any idea why it's doing that? Yeah, strange. Anyways. This is a gentleman, he's a trial attorney. Sorry, I keep, I'm used to having one of those mics here. So this guy's a trial attorney, and he came in and said, hey, I feel like my teeth are kind of affecting my career a little bit. So we're able to do this kind of stuff. So doing this kind of work, this gentleman comes in, his teeth are really worn down. And after several years, I was able to do the dentistry, but I started thinking, like, what's going on? Why do I have this guy that's 45 years old, and his teeth are more worn out than my 85-year-old patient? What's the missing connection here? And this inquiry kind of took me down a journey, and this is a picture of that gentleman. I wonder if it's a connection or a bad, I don't know if it's driving you guys crazy or just me, but.
Maybe that was it.
Maybe it's just not really plugged in. So basically, I become a kind of a crime scene investigator. So I look in someone's mouth and I want to know, hey, what's going on here? What's occurring? So if I were to ask anyone in this room, and you were to put on your dentist hat, any ideas what's going on there?
Too many Halloweens.
Grinding his teeth.
Grinding his teeth. Anyone else?
Or dental habits?
Or dental habits?
Meth.
Well, what if I said it's none of that? In fact, when this gentleman came in, I said to him, I go, hey, I bet people told you, I bet your previous dentist told you that you grind your teeth, didn't they? He goes, yeah, they all tell me that. And I said, I don't think you grind your teeth. He stood up out of his chair, he high-fived me and says, finally, I have someone that'll listen to me. And so it's like, okay, well, what's going on here? So the challenge that I face is people come into my office and they're kind of like this lady on this motorcycle. She doesn't even recognize that she's got her helmet on backwards. She doesn't even know that she has a problem. So my job is to make people aware of their condition. And it's ironic that I'm here as a dentist, so I'm talking about sleep and airway. That seems like the domain of a medical doctor, right? Well, this guy, Dr. Dimmitt, he's world famous. He's like the most world famous researcher from Stanford and in the medical community within the sleep. And he said the great irony about the emergence of dental sleep medicine is that generations of dentists have looked in the mouths of countless individuals without a knowledge of sleep disorder breathing. And given that the dentist is often the first and only healthcare practitioner to look in the oral cavity, a good knowledge of sleep apnea should be part of the profession's knowledge base. So what we're seeing now is a shift where dentists are now, those of us that are informed and stay up to date, we are in a unique position. I can't tell you how many dozens and dozens of patients that I've helped to get diagnosed properly because they didn't even know they had a problem, and somehow their medical doctor had missed it, because if someone doesn't come in complaining about a specific situation, it just doesn't get brought up. So I'll show you now this gentleman. This next slide should give away maybe what his problem was. Anyways, this is Larry the Cable Guy talking about heartburn. So OSA is obstructive sleep apnea. So what's the relationship? So if someone has acid erosion and they have their teeth are worn out, it's possible that their sleep apnea is causing the muscles in their diaphragm and all these intercostals, they contract and push and push and push, and this acid is constantly being brought up into the oral cavity. And so that's what this gentleman's diagnosis was. He had esophageal reflux, or GERD, gastroesophageal reflux disease. So basically what it means is we kind of have to look at things different. When we look at things, we change the way we look at things, the things we look at change. That's Dr. Dyer. Another quote that I love is the illiterate of the 21st century will not be those who cannot read and write, but those who cannot learn, unlearn, and relearn. And I find that pretty ironic in this group, right? Because you guys are fighting all kinds of dogma out there in the community about, like, you know, what psychedelics are, you know, and then some of that stuff is still lingers on. I was a victim of it myself, right? It's like I grew up in an era where I watched all the, you know, say no to drugs, this is your brain on drugs, and to me they were all the same. And we all know that that's not true. But this is the kind of stuff we fight, and I fight it in my profession. Dogma is you know, it's still there, and it's there in medicine as well. Hopefully, groups like this, we can start changing that paradigm and make people have better access to things that have a benefit. So as a dentist, these are some of the things that I can see. If you look at this gentleman's teeth up top there, if the screen would stay on, you'll see that he's got a lot of tooth wear. There again is another acid erosion situation. This is the back of someone's throat. Like, you guys probably, some people might think these are gross pictures, but this is my world. This is what I do all day. If you look on the back of their throat, you can't really see, you can't see the airway back there. It's all obstructed. Okay, look at those tonsils. Those things are almost touching each other. This is called an elongated uvula, so that little dangly thing in the back of our throat. People that have chronic snores or have sleep disorder breathing, that uvula actually gets stretched and elongated over time. So I sometimes look in there and that thing goes all the way down quite a long ways. And then this is a really interesting one. See that tongue? We call that scalloping, okay? So these indentions on the tongue are because the patients will posture their tongue in kind of a forward broad way because the brain is trying to find a way to adapt to maintain an airway. And so that postural position over time will actually leave permanent indentions in your tongue. Some of you might go home in the mirror and look on the side of your tongue and you might notice those little grooves. The other thing I'll point out is the teeth. If you look here at these teeth right here, see the chipping and the wear? But the chipping and the wear is not everywhere, it's just on the front teeth. So as people posture your jaw in a more forward way, because the brain is trying to adapt and trying to breathe and trying to survive, it will prematurely wear out those teeth. And there's some screening metrics that we use. This is called a classification, this is called a Mallampati score. And there was a pretty famous anesthesiologist from Italy named Dr. Mallampati, and what he did is he came up with this classification. It's still used in medicine. If you go in and you're going to have surgery and you're going to be sedated, they will often classify you as a Mallampati score based on 1, 2, 3, and 4. So 1, if you look in the back of the throat, you can see the uvula, you can see all the airway. There's space there, and then as they progress. At number 4, you look in there and you can't even see the throat. There's nothing there. So they know that number 4 is going to have a harder time breathing under sedation than the number 1. And so it's just another way. And so often patients that have sleep disordered breathing will fall in that 3 and 4 category. Okay, so let's transition a little bit and talk about sleep. What is normal sleep? Okay. Is there any sleep experts in this room? Anyone like to sleep? So sleep has stages, okay? So our brains have basically one of 3 phases that we're in. We're going to be in a awake state, or we're going to be in non-REM, or we're going to be in REM sleep, okay? So non-REM sleep has 3 different categories. N1 is what we call light sleep. There's N2, which is restful sleep, and N3 is deep sleep. And then there's REM sleep, which is totally different. Throughout the night, we will cycle through these different stages. Some people think, oh, you start out in N1, then you go to N2 and N3, and then you wake up after you had REM. Well, you may go through a series of these cycles several times throughout the night. And we know that light sleep, N1, that's when you're on the couch and you're getting kind of tired and you're kind of dozing off, and it doesn't take much to wake you back up. That's light sleep, that's N1. N2, I call junk sleep, because we spend a lot of time in N2, but it's kind of like, anyone have teenagers in this room, or had teenagers? And how was their diet? Could they survive off soda and junk? And somehow they get away with it, right? At least for a while. So N2 is kind of like junk food to me. It's like, yeah, you can live on it, but it doesn't have a lot of really restorative or reparative attributes. Where the good stuff happens is N3. That's the physical body repair part of sleep. So that's where our body physically repairs itself from injuries. And then the REM is like the mind defragmentation. So that's like defragmenting your hard drive. That happens during REM. So our brain is actually very active during REM, but we're in a catatonic state. You can't move. Anyone ever had a dream where something was going on, but you were stuck and paralyzed, you couldn't move your body? That you were in REM. That was a REM dream. We don't even fully understand why we sleep. Science doesn't even fully understand. We understand what happens, but that state of being paralyzed in REM, what's the purpose of that? I think that maybe because our brains are so active, it might be our body's protective mechanism so we don't get hurt during our dreams by acting them out. Some of the early scientists discovered that the brain waves is really where it's at, because different stages of sleep are characterized by different brain waves. So You know, these beta waves during, during the wake stage, we're in this. When we get into REM, we get more into the theta and delta waves. That wave amplitude changes as well as the wavelength. So you could spend, you could get a scientist in here and that could nerd out and spend hours just on this topic alone, because there's just so much in it. It would be really curious, some of you might be experts in this, like what effect does psilocybin have on these brain waves? It's got to have some effect on them, and that would be a really interesting article to read. Someone's smiling, they must know much more about it. So sleep apnea, the word itself is, apnea is a Latin-based word, it means without air, okay? So I like this picture because that's kind of what's happening. If I were to take a bag or plastic over your face and cut off your airway, that's exactly what's happening with sleep apnea. We'll get into a little bit more definitions, but I want to share this little video. Unfortunately, the sound is not great, but maybe if I put my mic here, you can hear it. Can you hear it? So right now you're seeing this guy, he's having an apneic event. There's no transfer of oxygen happening, okay? So there's an obstruction somewhere in his throat, and now the brain's gonna start getting signals that, hey, we're suffocating here. So now the brain is being stimulated by the adrenal glands, and the patient chokes and gasps. They take a breath, okay? That's called an apneic event. Has anyone witnessed someone have an event like that?
Oh,
Have
yeah.
you ever been to watch someone go through something like this?
Yeah.
Okay. So what's happening anatomically is, if you look at this diagram, when we breathe, we should be mostly breathing through our nose, not our mouth. But air comes in through our nose, through the nasopharynx, and it joins down here through the mouth, and it goes down into our lungs. With someone with obstructive sleep apnea, there's a blockage that happens somewhere in this region. So it's similar to having a garden hose with a kink in it. Nothing's coming out until that gets unblocked, okay? So the way sleep apnea is defined, so if you go to a sleep study or you talk to a medical doctor, they talk about definitions or apneic events. And an apneic event is a reduction in breathing for at least a 10-second duration. And then there's another thing called a hypopnea. And a hypopnea is a 30% reduction in airflow. So hypopnea is, think of it like a mini apnea. Someone that has a lot of hypopneas typically snores a lot. We've all been around people that snore, right? So they're still getting air, but that air is being pulled through a small opening and it's vibrating the tissues, and that's where the snoring sound is coming from. So what they do in the sleep physicians will take the apnea and the hypopnea and they'll divide it by the hours of sleep, and they get this thing called the AHI, the apnea hypopnea index. And that's what's used in medicine to define the severity of their sleep apnea. So if you have less than 5 events per hour, then you're considered normal. 5 to 15 is mild, moderate is 16 to 30, severe is anything over 30. So let's put this in perspective. Let's say you had a dog or a pet that came into your bedroom every night, about every 15 minutes, and woke you up. Now, I don't mean it wakes you up, but let's say it's just nudging you to where you kind of come out of your deep stage of sleep and you might roll over, and that dog is doing that every 15 minutes. How many of you would still have that dog sleeping in your room if it was doing that every 15 minutes? You would? Okay. I wouldn't. I'd find another room for it to sleep in. But, so if that happened every 15 minutes, that would be 4 events per hour, right? So that would still fall within the normal range. Now that's not normal to me, to be kind of aroused or stimulated every 15 minutes, but we've accepted that as somewhat a normal. So someone having even mild sleep apnea and having 5 to 15 events an hour can add up, right? That can add up. So imagine over a course of a night, you know, I had a patient that had 109 events per hour. Per hour, he was literally suffocating. And we'll get into kind of the health consequences of that next, but that's basically what we talk about. Now, oxygen saturation is important because that's really what this is all about, right? So if you got an obstruction, it's blocking your oxygen supply to your brain. Our brain is a very sensitive organ to decreases in oxygen. Now, when I read these sleep studies of patients that are going through this, I often find people that drop way down below the 80% mark. Now, if I got anyone in this room and I brought a pulse oximetry unit, I should have brought one of the little things you put on your finger, I would give anyone in this room, I would put $1,000 on the table and said, if you can get your oxygen level down to 90%, I'll give you $1,000 because I'm confident there's not a person in this room that can do it. No matter how long you hold your breath, you can't get that oxygen sensor to drop down below 90. So put that in perspective. These people are doing in their sleep, they're getting down into the low 80s sometimes. But you and I could not consciously get our oxygen level down to the 90 level, even if we were trying our hardest. So again, or obstructive sleep apnea is the most common type of sleep apnea. There's another one called central sleep apnea. That is not obstructive in nature. That's more of the brain is not telling the body to take a breath. That's a whole different topic, but that's another type of sleep apnea. Here's another video. Watch this guy. So right now he's basically having an apneic event. He's choking. No air's coming in. And in a second he's going to take a big gasp. So nighttime symptoms, snoring with intermittent pauses, snorting, gasping, waking with feelings of choking, sweating, thrashing in bed. Bruxism, that's the tooth grinding. That's why people that have sleep apnea will wear out their teeth because the brain starts grinding the teeth. Daytime symptoms are poor memory, poor concentration, fatigue, morning headaches, decreased sex drive, depression, irritability, acid reflux. You know, it's interesting, when I screen patients, I often will tell, we call it the disease of denial, because the typical male patient, his wife may be in a week before and she'll say to me, hey, my husband, he's snoring something fierce. Can you talk to him about it? Can you help him? And I don't want to throw anyone under the bus, so I might say, hey, how's your sleep? And they're like, oh yeah, I sleep great. Yeah, no problems with sleep. No. The wife was just saying she can't even sleep in the same room with this guy, and now he claims he has no problem sleeping. So it's like this disease of denial. And I will tell people, hey, you know, the studies show that if you have sleep apnea and it's untreated, you're 5 times higher risk to have a stroke. That's what the studies show.
Yeah, just a question on that.
Yeah.
Because I've known people have sleep apnea and stuff. And
Yeah.
often, I get what you're saying. Some people are just saying that they are
Yeah.
sleeping well, but I think for a fair number of people, they think they're sleeping well.
Yeah.
Right? Because it doesn't, even though that's obviously not healthy for you, it doesn't necessarily wake you up in the consciousness and be like, hey, ding ding, you're not breathing.
Yeah.
It's just disrupting your sleep pattern. So they might be, they might be trying to be more honest with you than
Yeah.
it seems based on their.
Well, I think that's a good
knowledge
point,
of sleep.
because I was that person myself. And my wife, as she started to become more aware of this, because we're treating people, and she's like, I think you have sleep apnea. And I'm like, I don't have sleep apnea. And she's like, okay, but I think you might. And one day, I woke up to my phone, there was a message from my wife who was laying in bed next to me. I'm like, that's weird. My wife sent me a message. So I opened up the video that she sent me, and it was like this, okay? And I'm like, damn, I better get a study. So I went down, checked myself into the local sleep lab with a sleep physician that I knew, and I had 53 events per hour. It was shocking. And I can tell you, since I've been under treatment, it's life-changing. I have people that have sent me flowers and written notes that it's changed their life. I mean, so back to your point, I think some people are unaware, right? And because it's not something that they are, you know, even myself, I didn't know was happening, but people know how they feel. And I had a gentleman just the other day, he said, hey, Doc, I just want to tell you thanks, because ever since you helped me discover I had sleep apnea, he got sent to his physician for treatment, and he said, I never knew just how like chronically tired I was. Now that I don't feel that way, and I can see the contrast, it's just, I feel like a different person. And it can affect relationships. We know that there's people driving on the streets and they're crying. It's worse than drunk driving. That's what the studies show. And it scares me to think about like some of these guys driving these big rigs, you know, and it's a scary thing. So I'm here tonight because I'm just trying to increase public awareness. So because everyone in this room, someone in this room either has sleep disorder breathing, they may be aware of it or maybe not, or they have someone close to them in their life, a family member. And hopefully you can leave here today with more awareness to help identify someone to get them in the right hands. But back to my story, these symptoms are interesting because when I tell a patient they may be 5 times higher risk stroke, the average male will be like, well, yeah. And then you say, hey, one of the other side effects is decreased sex drive or erectile dysfunction. You're like, hey doc, yeah, maybe I'll take that referral to get that study. Like, what does that say about us as a male species? I'm not worried about a stroke, but that's not gonna work good.
Different strokes for different folks.
There we go. That's a good one. So this is a daunting list. Sleep apnea increases the risk of, you know, stroke, heart attack, heart failure, kidney failure, blindness. The low pressure symptoms are rapid or shallow breath, fatigue, depression, palpitation, high blood pressure, heart rhythm disturbances, heart disease, pulmonary hypertension, sudden death, erectile dysfunction. I mean, the list is daunting, right? When I got ironically, I was having, around the same time I got diagnosed, I went through this weird episode of having heart palpitations. And I'd never experienced that. It was very anxiety provoking when my heart would seemingly like beat out of rhythm. And I know just enough to make myself nervous by going down rabbit holes of what it could be. And so I went to the cardiologist to have a workup. And then I said, oh yeah, by the way, I just got diagnosed with sleep apnea. And his response was, he puts his pen down, he's like, well, fuck, what do you think? That's what he said to me. And I'm like, he goes, you should know this. I go, yeah, I do. And he scolded me, and then he said, I'm a cardiologist. He says, at least 90% of my patients have sleep apnea. He said, do you think that's a coincidence? And I'm like, wow, that was a crazy statistic that he shared with me. 90% of his patients had sleep apnea, and he's a cardiologist. Something worth thinking about. Now this is an interesting study. This is called the Wisconsin cohort. And this was an ongoing study. And what they did is they took a group of people and they followed them over a course of years. And you'll see down here, you'll see the AHI. Remember I said there's less than 5. Then there's the mild, the moderate, and severe. And this was the mortality rate on the left. And then the years on the top scale. Now you look at the mortality rate at 10 years. Not a big change, but the severe group had a higher rate. At 15 years, these are untreated sleep apnea patients. The AHI, over 30% of them were deceased. At 18 years, over 40% of the group with severe sleep apnea were untreated, were deceased. That's a big number. And this doesn't even account those that had health-related problems, like maybe they didn't die, but they had a stroke, and they are now, dealing with that.
Is there any correlation between age and the emergence of sleep? Because I assume there's not a lot of sleep apnea in like 3-year-olds. Is that fair to say? So like,
I'm glad you brought that up.
It's more
We used to think, and I'm going to answer that question as we go on. I think so. There's also a study that has shown that people with sleep apnea, their bed partners are affected. It's kind of like someone that has secondhand smoke. You may not smoke, but if your partner does, you're going to get some of the ill effects from that. okay?
That was you're the whole person.
Okay, I get a lot of people in my practice complaining about their bed partners. Just last week, one of my longtime patients, I found out that his wife was sleeping in the basement and he's sleeping alone. So it's obviously having a negative effect on them. This is just a lot of study stuff from the Mayo Clinic. They basically found that people that had bed partners that had sleep apnea were also affected. The elimination of snoring and sleep apnea in these patients was associated with an improvement in the quality of their bed partner's sleep, blah, blah. Just, you know, they do studies on this kind of stuff. Seems boring to me, but it's interesting. So I want to share next a cool little story. So this gentleman, his parents were patients of mine for years, and they said, hey doc, our son, he lives in San Diego, and he can't find a good dentist. You know, every dentist he goes to, everything breaks. Would you be willing to see him? And I said, well, I'd be willing to see him and assess him. And he presented like this. He had some broken teeth. You notice the wear on the lower teeth, okay? If you get grossed out by this, you don't have to look at it, but there's a picture of him. And I said to him during the consultation, I said, you've had a lot of breathing and nasal breathing problems throughout your life, haven't you? And he goes, yeah, how'd you know that? And I can tell by his facial structure, he's got like some deviated septum, he's kind of deficient in the upper part of his face. And he goes, yeah, I've struggled with it my whole life. I've been to allergists and this and that. And I said, what if I suggested that the reason you're breaking your teeth is because you can't breathe at night? And he's like, you know, surprised by the correlation. Well, he's like, why didn't anyone ever tell me this? I said, well, maybe they just weren't aware of it. So this is an interesting view, and this next one is really crazy. So this is a dental implant, okay? This implant is, let's say it's about 5 millimeters in diameter. It's solid, it's made of a titanium alloy. It's almost impossible to break one of those the way where he broke it. But this was a guard that he was wearing. These are the teeth that I just put in place. And this is basically what was where that dental implant, that's where it was. So this guy was thrusting so violently forward to stay alive at night that he was putting stress that kept, this is the third or fourth set of crowns that he had up there. And finally he started breaking off the roots in the implants.
Ouch.
Okay? So what was his problem? Well, here's his CAT scan. He had massive nasal problems. He'd already had previous surgery. So his treatment consisted of turbinate reduction, basically making the nose so you can breathe properly, combined with some orthodontics, where we have to now go in and expand the arches to make them broader and bigger. And then finally, after that's all done, we can come back in and we can restore his smile back to function and aesthetics. And that's been 8 years, and he's not even as much as chipped a front tooth, because we addressed the underlying issue. It wasn't a tooth problem, it was a medical problem. And there he is, finished. Okay? Here's another classic example. See how the patterns of wear are just on those front teeth? The back teeth aren't wearing. So a lot of times people, they'll go to an uninformed dentist and someone will tell them that they grind their teeth. That's not a tooth grinding issue. This is an airway problem. This is another example of someone, this is what we call retrognathia. So if this person has kind of a deficient chin. So see if for the side profile has chin set back. And then these people that have that type of profile, see how narrow his arches are? His teeth are like kind of collapsed in and everything's crowded because there's not enough space in there. So this happened to this gentleman. This goes back to adolescence. So to answer your question, was it Troy or Tony? Troy. To answer your question, sleep apnea can affect children as young as 2 years old and younger.
I would assume as a percentage it's much higher than adult age.
Well, it happens more in adulthood because sometimes the disease doesn't manifest itself because children have, a bigger range of adaptability. But what we see is someone that has this kind of problem. Let's say as a kid, you don't breathe well through your nose. and you become this mouth breather, habitual mouth breather, your dental arches get collapsed and crowded and they get narrow, and so you go through life not breathing well, and then as an adult you start having serious manifestations of that affects your health. So we're helping to identify kids. We work closely with Phoenix Children's Hospital, some of the ENTs there to identify these kids. But here's a good example of this guy. See how he just kind of postures his mouth like this? Kind of this open mouth breathing posture. It's because he can't breathe through his nose. If you look closely over here at his chin, that mentalis muscle is puckered, it's contracting. So for this guy to get his mouth closed, he's got to really kind of work hard to make that seal. That's because he has dental arch problems that had never been identified. So now, to correct this guy as an adult is kind of a lot bigger deal, you know, because he might need a surgical intervention, whereas a child, he could have just had orthodontics, arch expansion, and it could have changed the trajectory of his life. Okay, so here's a video of sleep apnea in children. Look at this kid. Look at him struggle. So see his chest, see the muscles in his rib cage that's struggling because there's an obstruction higher up. So in kids, if you and I have sleep apnea, we don't get a good night's sleep, we're tired and groggy. These kids basically have this paradoxical reaction, they become hyperactive. So often they get diagnosed with ADHD, and because they're disruptive in school, they're driving their parents nuts, and guess what they do? They go to the doctor and they get put on Ritalin, and they get labeled as ADHD, and it impairs their cognitive function. A lot of teachers don't like working with these kids, and the sad thing is, the kid just can't breathe. We were at a family party a couple years ago, and all this extended family showed up, and I didn't even know some of the people there. And on the way home, I said to my wife, I said, hey, there's this young man, this young boy that was about 7 years old, and I described this young man. She goes, oh yeah, that's my brother's, or whatever. It's like a distant relative. And I said, I'm going to tell you about that kid. And so I went down this list and I said, he has behavioral problems. He wets the bed. He's disruptive in school, and he's been diagnosed probably with ADHD. And my wife says, how did you know that? Did you talk to him? I go, no, I just observed him. And I go, I could tell by his face. She's like, what do you mean? I said, well, look under his eyes. He's 7 years old, but he had these dark circles under his eyes. He postured his jaw like this. You know, he hung his jaw like this. I said, that kid, and they often have this kind of forward head posture like this. You ever seen a kid looks like that?
Yeah.
That's what they do. That kid is basically, his body's adapting to an airway problem and he can't breathe. So I said, hang on, go ahead.
Do you think that it's ever possible that it could be reversed instead of the sleep apnea causing the anxiety, that something like vagus nerve compression could be creating the anxiety, which could be affecting like the palatoglossus muscle or something that could then be going?
I mean, I suppose it's possible. I mean, vagal nerve is, we know, the autonomic nerves that controls all this, right? So if you have some type of vagal nerve dysfunction, it certainly could affect breathing. But these are typically more obstructive in nature. So if you assess this kid, you could see in his nose, first of all, he often has massive tonsils and adenoids. You look in there and they're just massive. And then they're turbinates, there's a lot of inflammation. So sometimes this can just be dietary in nature. Maybe they're having allergic responses to something that they're eating. Or it could be environmental. You know, there's a lot of garbage out there. Or a combination, or it could just be anatomical. You got some set of genes from his mom and some from his dad, and the combination of those two are just narrow arch forms. And then you add our kind of soft Western diet, you know, and all these things are all contributory. And that's why we're seeing, someone said to me, are we seeing more sleep apnea now because it's just getting diagnosed more, and we're more aware of it? And I don't know the answer to that. I would think that our modern SAD diet and everything else around obesity is probably, the prevalence is higher, plus our awareness of it is higher as well. So I see a lot of it in my practice. Back to the story of not this young man, but the one at the party, I said, to my wife, I said, tell his mom to go get him evaluated at Fetus Children. I gave her the name of the doctor to see. And I just kind of forgot the conversation. About 4 months go by, and my wife says, oh, remember that conversation we had? I got a call from his mother today, and she wanted me to tell you thank you because she followed through, and he got his tonsils and adenoids out, also went to an orthodontist and started treatment. She says she has a completely different kid. He stopped wetting the bed. His behavior problems almost diminished overnight. She goes, it's like he was a completely different person. And sadly, a lot of times, this gets missed even by the pediatricians because they may not want to take out tonsils and adenoids because the criteria is how many sore throat episodes did you have within a given year. And the insurance companies often will dictate that's the criteria, but they don't understand about airway and how this child not being treated can have a negative effect on his entire life. Let's see. So yeah, attention deficit hyperactivity disorder. Snoring is associated with higher levels of inattention and hyperactivity. 81% of snoring children with ADHD could have their ADHD eliminated if their habitual snoring were effectively treated. That's what an article said in a sleep journal in 1997. Children with ADHD are 2.5 times more likely to be bedwetters as well. This is just an article that's kind of confirming that. Anyone ever remember the movie Stranger Things?
Yep.
Did you ever watch that series? I don't know if the volume's going to be good, but he's kind of telling this story about this kid. Let's see if we can hear it. I don't think it's going to play for me.
Sometimes the videos don't work out.
Yeah. Anyways, this is just a scene from the movie where he had gotten beat up by somebody, and he's like, "Who beat you up?" And he goes, "You know, that mouth breather kid." And he's like, "Mouth breather?" He goes, "You know, like a stupid person." And I thought, like, wow, that was interesting enough for me to take the clip, because if you think of someone that mouth breathes, they kind of fit in that profile. You know, even the movie producers writing scripts are writing that kind of stuff in there because there's a profile of this type of person. They're like, you know, that phrase knuckle dragging mouth breather. It's like this person that's kind of like, that's what they're doing. And it's not to make
like
fun of them. What's that?
A cretin that's hypothyroid.
Yeah. So all these things play a role in there. There are often complex medical problems. There could be metabolic issues, because all these airway problems contribute to a lot of other things. So, you know, how do we screen patients? These are some common symptoms. Snoring. Sometimes people think, oh, snoring is normal. Snoring's not normal. Like, if you're snoring, there's a restriction in airflow, particularly a child that snores. That's a big red flag. If they feel unrefreshed in the morning, daytime sleepiness is a common symptom for men. Excessive daytime sleepiness, waking up with a dry mouth, waking up with heart racing. Those are all common symptoms. People that have hypertension, AFib, diabetes, depression, obesity, pain, all these things are comorbidities that often people with sleep apnea will have several of these. Okay? Risk factors, we know obesity is a big risk factor, but it's not the only one. I've had fit young women. I had a woman that was 35 years old roughly. I would be shocked if she weighed more than 110 pounds, fitness addict type, and we got her tested. She came in with TMJ symptoms, pain in her face and muscles. She had stop breathing 35 times per hour. So women will often get overlooked when they go to their physicians for sleep apnea because they don't fit a profile. If this guy walked in and said, "Hey, I'm tired in the mornings," they're going to do a sleep study on him, right? There's this thing called the Epworth Sleepiness Scale. You guys can almost do it while we sit here. So you basically have this score from 0 to 3, and you give yourself a score in each category. So for example, the first one would be, how likely are you to doze off or fall asleep in the following situations. You should rate your chances of dozing off, not just feeling tired, even if you have not done some of these things recently. So, sitting and reading. So, any of you in the room, if you sat down and started reading, how likely are you to doze off from that experience, okay? If your answer is no chance at all, you're 0. If you're slight chance, it's 1. Moderate, it's 2 and 3. So you give yourself a score in that category. Watching TV, same thing. Sitting inactive in a public place, at a theater or a meeting, as a passenger in a car, lying down to rest in the afternoon when circumstances permit. Anyways, you go through this and you give yourself a score, okay? And if you're 0 to 7, you're unlikely to have sleep disorder breathing. But if you fall in this category where you may be anywhere from 10 to up to 24, probably a good indication that maybe a sleep study might be in your future. Yes?
Is there, like, how do you think about it in terms of if you're drinking a lot of coffee? Is it like, can it counteract it to this extent that your score looks low, but really you have it?
Yeah, well, caffeine works on the, it starts with an A, but anyways, it's like a false, what? Yeah, and on that, and so you get this kind of false sense of stimulus, and then sometimes I think people are medicating themselves. It's like they get up and they can't start their day until they get some caffeine in them, right? And it's like this vicious cycle. Does that answer your question?
Yeah, so you're basically saying if you weren't drinking caffeine, what would it be like?
Yeah.
That score.
Exactly. So it's not a diagnosis, it's a screening tool. There's another one called Stop Bang. It's an acronym. If you snore loudly, that's the S. If you often feel tired or fatigued, has anyone observed you stop breathing? Do you have already taken high blood pressure? So that's the stop, and the bang is a BMI over 30, age over 50 years old, neck circumference. If you have a neck over 16 inches, you're a higher risk. I'm not particularly an overweight guy. I might have 10 pounds extra on me right now, but I got a thick neck. I was a wrestler. I'm kind of that build. The NFL is plagued with sleep apnea. These athletes that are in the NFL, they have a truckload of sleep apnea in the NFL. So it's not even just about whether you're athletic or whether you're fit. It's just anatomical structures can all play a role in it. This is one of those things where it's like we look at our country and we go, man, what is happening? If you look at obesity trends and you go back to, let's say, 1994, you'll see that in the highest category, 15 to 19%, these southern states were in that, okay? Then you drop forward 10 years later, in 2024, look at this, 25%. I mean, the obesity trends are just out of control. Here's 2004. This is the most recent. Look at these states that over 35% of the population's obesity. 30%. Arizona, we're right in here, 25 to 30. It's a trend that's occurring. Okay, we all are aware of that. Now, I thought this was a great slide. But this kind of makes my point, okay? This guy walks into his medical doctor, and he's probably going to get a sleep study, right? You don't need a medical degree to diagnose that this guy probably has a hard time breathing at night. But you know who doesn't get a sleep study? This woman. This woman goes to her doctor, and she's complaining of depression, or anxiety, or facial pain, headaches. And this is the person that gets overlooked because she doesn't fit a profile, okay? But it's been my experience as a dentist that treats a lot of TMD disorders. When I have a woman that comes in with TMD, the first thing we're gonna do is we're gonna rule out whether there's a sleep disorder breathing issue because they are very, very closely related to one another.
Do you happen to know the statistics on like the average American adult population, X% might have sleep apnea issues?
That statistic is readily available, and I used to have it memorized, so if I said it, I would be wrong. But what I do know is that the amount of undiagnosed people that they figure are out there is absolutely astounding. We started screening every patient that comes into my practice, And we found through our own database that almost a third of our patients were in some category of sleep disorder breathing, and that's a big number when you just look at the population. So there's a lot of people that have it that don't know they have it. If they don't have a bed partner or someone that said it to them, they may not be aware. If they have a physician and that woman walks in, she's not gonna get diagnosed, or it might take a while to figure out what the problem is. So, depression or obstructive sleep apnea, chronic fatigue syndrome, anyone ever know anyone that was diagnosed with chronic fatigue? Fibromyalgia is another one, because these people have chronic muscle pain. Remember in the stages of sleep I went over, and stage 3, non-REM 3, that is like where the body gets repaired. So if you have someone that's not staying in stage 3 sleep, they're gonna likely have a lot of body pain. Okay, it's a muscle pain because they're not getting that regenerative sleep. TMJ is another big one. Carotid, there's another study that showed that people that have heavy chronic snoring get calcium buildup in their carotid arteries right in here, because they feel the vibration somehow has an effect to cause a calcium buildups in those carotid arteries, which is really quite an interesting study. The diagnosis of obstructive sleep apnea comes from a physician, not a dentist. As a dentist, I can screen somebody, I can think I have a high suspicion, I refer them to a sleep physician that can do the appropriate test. So that's important. This is me in my sleep study. And so you'll see that I have a lot of electrodes hooked up to me. That's when I got my diagnosis with 50 events an hour, or 53. Now the good news is that now we have these things called home sleep tests. This is kind of an earlier generation, but now we have them that are just a device that you wear on your hand and your finger. And so they're really easy to do. And so you can get a diagnosis without having to go stay the night in a sleep lab, which has made a lot more people willing to do that. So that's what this looks like. This is kind of an example of a modern home sleep test. Again, just some more slides of what's happening. This is an example of a CPAP, and then this other device is an oral sleep appliance, and I'm going to go into that because that's kind of where I come in as a dentist. So basically, what a CPAP does, it's an acronym for continuous positive pressure airway, okay? And what it does is it pushes air. Some people think it's oxygen, it's not. It's just room air that's pressurized. It goes into your nose and mouth, and what it does is it opens up that space by pressurizing the airway, okay? The oral device that I make is an alternative to CPAP. There are people that say, hey, I don't want to wear a CPAP. They don't like the stigma of it, or they just can't get used to having the device. There's a device that I can make that brings the jaw in a more forward position. I'll share that with you here shortly. So that's the CPAP mask. This is kind of how an oral device, this is an old school one, but any of you take a CPR class? Remember that head tilt chin lift maneuver? Why'd they teach you that? Opens the airway. So basically the device that I make that people wear at night simulates that. It holds them in a more forward position. It holds your jaw forward. And by doing that, you can unobstruct the airway. Now the devices that we're making now look more like this. They're a lot more comfortable, they're a lot sleeker. But that's basically what we're doing. We're just bringing anatomically where these circles are. You can see that's where the obstruction is. And when we protrude the mandible forward and we hold it in a more forward position, it opens up that space so that tongue is no longer blocking the airway. And that's basically the simplified version of what's happening. Or you could do this. There is actually, the reason I picked this slide in there is sometimes our patients wear dentures, right? And so if they wear a denture, I can't make an oral appliance because I need the teeth to anchor to that's got to pull their jaw forward, and the denture doesn't have enough, structure to grab onto. So there is a device called a tongue retaining device. It's like a little suction cup put on your tongue, and it seals around the outside of your mouth and actually holds your tongue forward. And it's kind of doing what this guy, remember the movie with the Christmas Story?
Shoot your eye out.
Yeah, shoot your eye out guy. Yeah. So that's that tongue retaining device right here, a little suction cup with the tongue. I've never used one for anybody, But this is just some examples of different mandibular repositioning appliances that we use.
Are you familiar with and or have any thoughts on mouth taping?
Yeah, I'm a big fan. I do it myself.
Oh, okay, cool.
But don't do it until you know you breathe well through your nose.
So in that case, let's say you may not breathe great through your nose.
Yeah.
Is there any? And I've been doing it for almost a year. Like
Yeah.
I love it. I think.
Yeah.
And I use a tape that's like a little bit of like it's not like I'm not like duct tape in my mouth.
Yeah.
You know, so there's a little bit of like room for my mouth
Yeah.
to open if need be.
Yeah.
So let's say you don't breathe great through your nose, but you
Mhm.
breathe enough. With doing that, would it actually like, is it a way to like strengthen your nose breathing? Does it like actually improve it?
Well, I think there's different theories on that. You know, obviously breathing is a complex physiologic process with muscle, vagal nerves. I mean, it's complex, right?
Yep.
This diagram just gives you some small idea of how many different muscles are involved with breathing and airway, okay? But the mouth taping is basically partially retraining because we should breathe through our nose, not our mouth.
Yeah.
We've got nitric oxide, there's all kinds of physiology that's happening. Mouth breathing has a lot of there's a lot of studies on the ill effects of mouth breathing. It's not a healthy way to breathe. There's a product called Xclear, Xclear, it's called Clear. And it's a nasal spray that's xylitol based. And it's not a habit forming, it's not like Afrin that you can only use for a few nights, but it's a great nasal hygiene. If you get Clear, you can get it at Sprouts, you can probably buy it on Amazon. It's Xlear, is how it's spelled. We find that if we have people just put a spray of that in their nose at night, it helps hydrate the nose, it helps dilate for the breathing. I always do it before I go on a plane because there's some studies that show that the xylitol in the nose can help kill germs, viruses, and bacteria that get, so like COVID or whatever that you breathe in on a plane.
It's the nitric oxide, right?
What's that?
The nitric oxide?
Nitric oxide is produced in the nasal cavity, so it helps dilate blood vessels. So there's no nitric oxide in Clear itself. It's just saline and xylitol. Yes.
I have a pillow that tilts my head backwards.
Yeah.
How's that different than the apparatus that pushes your mandible forward?
Well,
I mean, not your mandible, your maxilla.
Yeah, well, it is your mandible, not your maxilla is fixed to the base of the skull, so
Okay.
it's the mandible that we pull forward. But to answer your question, so if you were on, let's say you're laying on your back and you
Yeah.
have that comfy pillow, but your mandible can still drop back,
Ah.
right? So being on your back is almost the worst place to be for your airway. I happen to love to sleep on my back. If I fall asleep on the couch and I'm on my back, I basically choke myself awake. I just can't do it without an appliance in. So the pillow may help you posturally, but it's really not helping your airway. If you're on your back, it's probably worse. So what are the solutions if you have sleep apnea? I'm gonna go quickly through kind of the main sources of treatment. Anyone ever heard of orthognathic surgery? It's kind of a big fancy word, but basically what that is a surgical procedure performed by an oral surgeon where they would actually advance the lower jaw surgically forward. So that picture I showed you, that guy that had that weak chin, he's a candidate for that. Because structurally his lower jaw needs to be brought forward. And so you'll look at some of the hardware in that picture where they've put the hardware where they've actually, and you can change a person's whole profile, and then by bringing that forward, you can open up their airway.
How does this compare to mewing constantly?
Oh, I was just gonna ask.
To what?
Mewing.
I don't know, enlighten me, am I missing it?
You can modify your facial and bone structure by modulating the amount of tension that is present inside your mouth. I
Yeah.
don't know the exact technique, but people have really blown
Yeah.
out their face by going to the far extreme.
Yeah.
Because there's an app you can scan that shows you how much you're mewing, and people are like cranking it up, and it looks really crazy.
Yeah, well, it's interesting you say that. There's a whole discipline called myofunctional therapy. There are myofunctional therapists that are specially trained to help people understand how to posture their lips, how to posture their tongue, and you can have a profound effect on someone's airway and someone's musculature by a myofunctional therapist helping. So it's great for kids. So I'm a big believer in it. I think it has its place. You know, it's just like anything else. So in my mind, that technique, you know, it's just like if I go to the gym and I work a muscle a lot, it's going to grow. Now, as someone that happens to treat a lot of TMD, when I saw this one ad of this guy that developed this device, he's like, yeah, you just chew on this, and then look how masculine my jaw looks. And I'm looking at that going, oh, don't do that. You know, because I see what happens when the muscles are overactivated, right? There's pain and dysfunction. So it might aesthetically look cool. Most of the people are coming to see me because they want Botox, so they don't, particularly women, they don't want that bulky masseter, and I can contour their face with Botox just by, you know, shutting the muscles down for a period of time. We usually do it just for pain, not aesthetics, but it can have a huge effect. So, myofunctional therapy, yeah, by all means, it's legit. And because this is a pretty, and this isn't involved surgery. I mean, your surgeon's going in and literally breaking the bones in your face and moving them around and screwing them back in a different place. So that's not something you just jump into lightly, but it can have a profound impact on somebody. There's another one you probably heard advertised called Inspire. Ever see the ads on TV for Inspire? So basically what this is, they advertise this as, hey, you don't need to wear CPAP anymore or anything. We can give you this device. So that little thing on the chest, that's just an illustration. That's actually implanted on the chest wall like a pacemaker. And there's a lead that goes up to a nerve called the hypoglossal nerve. Hypoglossal nerve is what controls our tongue and muscles. And they will actually implant this device. When they activate it, when the patient takes a breath, their tongue gets stimulated and the tongue moves forward every time they breathe. What? So, no, I kid you not. So, I had a patient that had one, and he brought in his remote control. Literally, it has a remote control, and he activates it before he went to bed. And he goes, watch this, and he activates it. And he shows me how his tongue can do this. And then he says this, more information than I wanted. He goes, my wife really likes this. And this is like a 75-year-old, dirty old man. Like, I bet she does. Yeah. Too much information, I know. So this is just a lot of boring research stuff, combining oral plants with CPAP. So basically, I don't, as a dentist, I make appliances. I don't do CPAP, but I don't have a bias. My bias is, I had a woman in today, and she's on and on about her CPAP, and she has severe sleep apnea. I'm like, you know, my advice is get comfortable with your CPAP. It's going to change your life, you know. So I'm all about whatever the patients are going to wear, and they're going to be consistent because it can be a game changer. Neurobehavioral function, energy levels, vigilance, less anxiety. I mean, on and on. It's a long list of positive outcomes when you treat sleep disorder breathing. These are guidelines from the American Academy of Sleep Medicine. Not particularly relevant to you guys. It can get covered in by medical insurance. Possible side effects with oral appliance therapy: you can have jaw pain if you get over advanced, the muscles aren't adapting. There's ways around that. You can have bite changes if you don't do these exercises that we have you do in the morning to get the muscle back where it belongs. We like to predict the problem before you. Now, this is a cool slide, at least for someone like me. I geek out at this stuff. Anyone know what this is? It's a cadaver, just so you know. Okay, everyone in this room has two of them. That'll help. Yeah, TMJ joint, okay? So that's the jaw. So this is basically what they're simulating on a cadaver species, what happens in the jaw joint. Anyone in this room have a jaw that clicks and pops when they open and close? Yeah? There's always going to be, in any room, there's going to be a handful of them. So what's happening is this right here. This is the person opening wide. Now they're closing, they go back up into the fossa. Right in this thing right here, that's a cartilage disc. So someone that has popping, what's happening is that disc is getting off, and when they open, and then when it goes back to place, it makes a popping sound. Most people get it backwards. They think the popping is when it's coming off. It's actually when it's going back. And sometimes people will get stuck. That disc will get off, and I've had people come in my office where they're stuck open. I had a woman that came in, she was 18, and she couldn't get her mouth open for 3 months more than this much. And it's pretty rewarding when you can send her out 20 minutes later and she's unlocked and in tears like life has changed.
Do you think that could be caused by a connective tissue disorder?
Like Ehlers-Danlos, things like that. Certainly, I don't think it's a coincidence that most of the patients that I see that have TMD disorders are women during childbearing years. And I think personally there's a hormonal impact on that because we know that, Tocin and these different hormones, oxytocin, have an effect on ligamentous structures to allow the pelvic girdle to expand. So I think that it's not selective. It doesn't just say, hey, only affect the pelvis. I think it can have an effect on other. And now you add some dysfunction, clenching, or sleep disorder breathing to that mix, and now you have a full-blown TMD problem on your hands. So again, here's upper left. That's a normal joint. So that disc, see how it stays in place on the upper left? Open and close, it just glides along. The next one is a reducing disc displacement. This is the person that pops. So if you look in that middle one, see how it comes out of place? And then they go to open, and now it's gonna pop back in, right there. Boom, that's when you hear the pop, okay? And then the last one down here, some people think the popping joints are the worst ones. The popping one, at least it's going back to place. The worst ones are the ones that don't pop anymore because the disc it's lost its elasticity, it's gotten flattened out. And then down here, this internal derangement, this is degenerative joint disease where the bones are just remodeling and the bites are changing. So we see some pretty crazy stuff. If anyone likes to read, this is a phenomenal book. Matthew Walker. I heard about this guy on the Joe Rogan podcast. Anyone watch Joe Rogan podcast? I'm a huge fan. But this guy was a guest on Rogan, and Why We Sleep. It's a fascinating book. This guy's he's a researcher, he's a PhD, but this book is written in a very format. It's not like reading a science book. It's very well written and interesting to read.
Yeah, I've read it, it's really good. And
Yeah.
I've been on Peter Attia's podcast like 6 or 7 times. He's really good.
Yeah.
I have another book about breathing and sleep.
Yeah.
It's called Breath, The New Science of a Lost Art by James Nestor.
Yeah, Nestor. Yep. So yeah, this guy's on the right track. He knows all the good ones. So I don't know that this audio is going to work, but this is a clip from the movie, or the Doctors. And they had this woman on here, and the show was this cosmetic surgeon was all talking about how he can do Botox on muscles in the face. And this woman tells her story, and she's talking about, I've been to chiropractors, I've been to acupuncture, and I was told I have sleep apnea, but I have this debilitating pain in my head, and on and on and on. And I'm watching this show, and you got 3 medical doctors here, and no one gets it right. It's like no one bothers. She said her problem. She's like, I have sleep apnea, and I wake up with headaches every morning, and I'm in all this pain. And they think that getting some Botox in her masseters is going to fix the problem. And I'm just like, this is what the public's watching, just really bad information.
It's like big pharma.
Yeah. Anyways, I put that clip in there for what it's worth. So, who's counting on you? I put this slide in there because in this room, every one of us knows somebody in our circle that has this problem. I guarantee it. It could be a close family member, it could be a friend, and you may have the ability to actually change the course of someone's life by just speaking up. Just not being afraid to say, hey, I noticed this. I've approached people in airports that I'm like, this guy has sleep apnea. I had a guy sitting behind me in the plane one time, and I just heard every apneic event he had, and I could not say anything. So I said, hey, couldn't help but notice when you're sitting behind me, happen to be well trained in this. I think you have sleep disordered breathing. Were you aware of it? He's like, what's that? I go, you ever heard of sleep apnea? Oh, I've heard of it. I'm like, you need to go get a test. Your health is at risk. So I'm no longer afraid to open my mouth because I feel like I'm helping people, even if they don't ask for it. But I do find it very ironic that in my practice, and I think it's because when people come to the dentist, they're not thinking about sleep, we're having a conversation about sleep and airway. So when we first started talking to people about it, we were kind of met with some weird resistance, you know, like, well, are you trying to sell me something? What's this about? Well, it turns out that dentists are playing a big role in this space. The American Dental Association actually came out with a statement encouraging all dentists to screen patients for sleep disordered breathing, because they recognize that we are in a unique position. We're looking in there and I can see things that often their physician didn't catch. And sadly, our modern healthcare system, if you've been to your physician lately, they have like 10 minutes to see you, and you can talk about one thing per visit. You know, it's pretty frustrating, right? They're on this treadmill of how they have to practice, and so I think it doesn't get noticed sometimes because it just, there's not time, or if it's not brought up as a possibility. We have to become our own healthcare advocates now more than we ever have. And just stuff like this is just raising awareness. So hopefully this was somewhat interesting for you tonight. That you left here knowing maybe something new that you didn't when you came. And if that's the case, I feel like my time was well spent. I appreciate the invitation. This guy is, as you know, he's friggin' awesome. My staff, he's only been in the office 1 or 2 times, and I think everyone on my team just loves him. Oh, the guy with the mushroom beard. And I even got this dude to take off his shirt in my practice and show me all his tattoos on his back. So if you haven't seen him, I would recommend you do a demo of him. It's pretty impressive.
They've all seen him.
Yeah. And yeah, you know, he doesn't have the.
It's gone now,
Yeah.
but it'll be back. Don't worry.
Yeah. So, anyways, any other questions that came up? Hopefully, I covered most of them, but I'm open to whatever.
Yeah, I have a question. So you mentioned that there's a correlation between like cardiac events, ADHD. So I was wondering if like taking things a step further, if POTS and dysautonomia and like autism and other items like might also be correlated to lack of proper breathing.
Well, POTS being, or the orthos, yeah.
Postural
postural. I don't know specifically of any correlation to that. We know that neurodegenerative diseases, certainly someone with ALS or any disease that will affect, you know, the muscles and how they breathe. I mentioned vagal nerve dysfunction. Certainly those kinds of disorders could contribute. Now, I've mostly spent most of this time talking about obstructive sleep apnea. If you look at sleep disorders, there's probably 100 different ones, right? And it just happens that obstructive sleep apnea is the most common one. However, there's lots of different neurologically related, you know, limb movement disorder, insomnia, narcolepsy. I mean, it goes on and on and on. You really need a board certified sleep doctor or a neurologist to make those kind of diagnoses. That's certainly outside of my scope. I may be aware of them on a superficial level, but I couldn't really answer that question with an intelligent, definitive answer.
I have another question. So kind of like more of the off-the-wall sleep diagnoses, like sexsomnia, for example, could that be like lack of oxygen to the brain as well?
What did you call it?
Like sexsomnia, for example.
Sexsomnia, that's an
like
interesting
more
one.
strange, like sleep disorders,
Yeah.
or those associated with lack of proper breathing.
I don't know the answer to that. But a neurologist or a sleep physician may answer that. I just know the brain loves oxygen, and so we need to keep it oxygenated. When the brain, so to answer the cardiac correlation, what's the correlation? Here's what happens. Remember that video when they showed the guy and they showed his brain being turned on? When you have a decrease in oxygen saturation, the first thing that happens is the adrenal glands, which are down near your kidneys, the adrenal cortex will secrete stress hormones, cortisol and norepinephrine. And it's crazy how fast this feedback mechanism helps. Because I've been in sleep labs. When I became board certified in dental sleep medicine, I had to spend a lot of time in sleep labs observing. And it was astounding to see these people hooked up to all this and see how quickly the physiologic response. You'd see them have an apneic event, and then you'd see the monitors just go crazy. Heart rate would be accelerating, the oxygen saturation. So what's happening is those hormones are being secreted. It's like giving someone a shot of adrenaline. So the heart rate just goes from like 60 something beats to 100 plus like that. Okay? And so the relationship to people dying in their sleep apnea often isn't the cause on the death certificate, but it often is the culprit. Because what happens is, during REM sleep in particular, if you look statistically, a lot of people have heart attacks in the early morning hours of their sleep. They're often in REM sleep during that phase. The brain can be very active and heart rates can get spiked. And so I personally believe that what happens is someone has a spike in their heart rate from a response to this, and then all of a sudden they get thrown into an arrhythmia. So that heart no longer is beating in a rhythmic way where the blood is going through properly. It gets out of rhythm. And so if someone gets out of rhythm and they happen to have the wrong kind of rhythm, like AFib is not so severe, but you have someone has ventricular fibrillation and they're not transporting blood. If you're not there to shock them with defibrillators, they're not going to survive. And so I think that a lot of people may die in their sleep it's sleep apnea related. I had a patient in just this week actually who told me that one of their good friends was 35 years old, died in his sleep, had a wife and 3 kids, died in his sleep, and his doctor said it was sleep apnea. It was untreated. So again, I just never hesitate to open my mouth when I think someone's at risk. The worst that can happen is they get a study and they come back negative. And we all go to I don't know if we all do, but I get a physical every year with my doctor, and routinely they do blood work. It's part of it, right? They do an EKG, they do blood work, they check your vitals. I think personally a sleep study should be part of that routine.
Especially with the ease now, right?
Especially how easy it is, yeah.
Have you ever heard of buteyko breathing?
I've heard of it, yep. It's kind of a shallow but rapid, isn't it?
Well, the idea is...
Isn't that Nestor that promotes that?
I don't know about Nestor, but it's reducing the tidal volume of respiration until the sensation of air hunger arises, and then maintaining that uncomfortable sensation for 15 to 40 minutes while staying relaxed to increase your CO2 concentration of your body. But I've seen people report that after doing this for about a year, they only need anywhere from 4 to 5 hours of sleep consistently at night.
Yeah.
Which is crazy.
Yeah, I mean, the studies I've read say that humans need more than that, but I don't know if it took into account that type of technique, because I know what's his name, the Iceman, Wim Hof. That's kind of his stuff, Wim Hof, right? And you look at what this guy can do. He can control his physiology. It's just crazy. And I was so fascinated by it that I wanted to try it. So I have an aversion to cold water. I hate cold water more than anything. But this place opened up near my house. I drive by it. It was one of these cold plunge places. And so one day, I'm an athlete from way back when, so I like to play head games with myself that I can overcome hard stuff. But I knew that was going to be like damn near impossible for me. So I just walked in one day. I just made myself drive in there, and I walked in and I go, I hate cold water. And they started laughing. They're like, well, you're at the wrong place. And I go, yeah, but that's why I'm here. I want to beat it. And so I got the tour, and I'm like, what's the coldest one you have? And they go, that one, it's 33 degrees. It has ice layer on it. I go, that's the one I'm doing. They're like, man, you just go for it. And in my head, I was like, if I can go 1 minute, I feel like I did well. But I lasted 3 minutes my first plunge. Then I got 4, 5, 6, and my record was 8 minutes and 33 degrees. And so I know that it can be done. It's like you can, through breathing, you can control the physiology. It's powerful and crazy.
Well, and it's mental focus too.
Yeah.
Breathing is just helps get your brain.
100%. It's just you take that sympathetic response and you take over and you go, no, I'm not going to feed into that. I'm going to take over. And I think that's what Wim Hof has mastered, right? That's why he climbs Everest in a pair of shorts. Now, I remember floating in this tank or sitting in this tank like this, and I remember having this thought in my head like, okay, I know I can do this, but I also know that I can get out anytime I want. So I had this thought, if I was hiking in a frozen lake and this happened to me, could I still maintain the calm that I had? And I don't know that I could, because at least you have the comfort of knowing like, okay, I can get out when I want, and if I code in here, there's someone going to drag me out and do CPR on me. But I found that it was a very invigorating experience, and that mental achievement was for me was pretty awesome.
I noticed, like if you do a cold like exposure regularly,
Yeah.
your body will activate and increase its brown fat
Yeah.
volume, and that'll keep you warm over. You're able to do it more easily over time.
Yeah, what's his name? The Butterman or something? He talks about that. Anyways,
Huberman,
Yeah.
Huberman, yeah, Huberman.
yeah, he talks a lot about that. But he also says never drink alcohol ever.
Ever.
Yeah, like 100% no. I wonder what do you think about, psychoactive stuff.
He did a podcast and check it out on Sullivan.
Oh, is it?
Gary, what'd you say?
Yeah,
You have something? Do you have a question?
yeah.
Do you, as part of your like assessment tools, do you ever use any like functional imaging?
Yeah, CT scans. I thought I had one on here. So we have in our office a cone beam CT scan. So it's like a CAT scan, but it's just for the head. So I get an image from like here to here, 3-dimensional. So I can look at the airway, I can map it. The only problem with that is the people that sell it love to promote it as, look at this, you can screen airway, and I bring to their attention, yeah, but that patient's awake sitting up.
It'll
in
lay 'em
the
down,
scan.
yeah.
So how does that correlate to someone asleep? Now, if you have someone awake and they have a 2-millimeter airway, you're probably going to assume that it's going to be a lot worse when they're asleep. So it's not like it's bad information. It's just you would never use it to diagnose somebody.
Does it show the nose part and stuff?
Oh yeah, it's great for showing nasal septums and sinuses. So we found a lot of people that have nasal polyps. I refer a lot of patients to ear, nose, and throat doctors for evaluations because the key is get someone breathing through your nose. So like you, if you're gonna mouth tape, just make sure you got good nasal patency, that you're not breathing through your nose. Sometimes that's modifying diet or maybe dealing with allergens, or in some cases it might require surgery. For myself, I had turbinate reduction, which was amazing. I went from feeling like I always had a stuffy nose to I almost never feel like that anymore. I can just breathe through my nose.
What did you do to have
It's
that?
called turbinate reduction. So you have these little things in your nose that are called turbinates. So if you look at them on a cross section, they have these little pathways that are in there called turbinates. And what they do is they act like little turbines for air, but they have cilia, which are little micro hairs that filter air,
make boogers.
humidify it. They're like it's like a
where they hang
filter.
out, right?
And the nitric oxide is something that they think plays a role in regulating your blood pressure.
And you got them reduced?
Yeah,
Is it like surgically or
Yeah.
like?
surgically. So they go in there with a roto-rooter or something, I don't know, I was asleep. Well, it was really cool because I woke up from surgery and I was like, this is amazing. And I was breathing like I'd never ever breathed before, but swelling hadn't set in yet. So the next day I woke up and I felt like I had the worst cold of my life. I couldn't even get any air through my nose. And I was a mouth breather for a week. And then when the swelling went down, it's been pretty awesome ever since. Yeah, no more hard ones. She asked hard questions.
Hopefully it's easy.
Yeah.
I work in ophthalmology, and the way that I document exams is FES, floppy eye syndrome, and it's almost always that they have sleep apnea. And so if it reduces the elasticity in your eyelids, is it possible for it to reduce elasticity in other connective parts of your skin?
So you're saying that it causes a laxity in the lid?
Yeah, so we call it floppy eye syndrome, FES. And
Yeah.
it's primarily the lower eyelid, but it can be both eyelids, and just like pretty substantial loss of skin elasticity. And we see that it's generally indicative of sleep apnea. So I was
Interesting.
wondering if that could extend to other tissues in terms of losing elasticity.
Well, I would think in the eye, we've all experienced where you didn't get enough sleep and you wake up and your eyes look tired and puffy right here under the eye. So I think that if I were to speculate, someone that you think may have sleep apnea, it may be these people kind of fit a profile. So they tend to retain water, they tend to have a lot of extracellular fluid, and the lymphatics in this region aren't great at draining, right? So people either get a lot of fluid accumulation. If they ate a lot of sodium, it's going to accumulate there.
Is that due to hypoxia or something? Because when somebody
I
gets
think
strangled to death, they have bloodshot eyes, and there's
Yeah,
a
I don't know. I think what
physiological
it is,
effect.
I think as we age, there's some little fat pads here, there's what's called an orbital retaining ligament, and the orbital retaining ligament can get weak, and now some of those fat pads tend to herniate through that. And so if you've ever heard of a procedure called a blepharoplasty, they'll actually go in and they'll make an incision, they'll take some of that extra fat out of there. And because you've seen some people that have that just chronic bulge under their eye. So I think sometimes people with sleep apnea have just generalized, they're not healthy people. If you have untreated sleep apnea, you're just not in a state of health. So you're gonna have maybe more lymphedema, maybe more fluid accumulation, blood pressure. I know for myself, after I got treated, my blood pressure went down. I don't have heart palpitations anymore. The only time I ever had heart palpitations is I ate an edible that had sativa. That was not that fun. But other than that, I don't just randomly get heart palpitations anymore.
Good.
All right. Thank you, guys.
Give that to Dr. Sheldon. Here at the Arizona Psychedelic Society, we don't only care about your mental health and your spiritual health, but also your physical health. Right? We all sleep, so I know this might be kind of only semi-tangentially related to plant medicines, but I think it's important. It's important for us, right? It's why we do things like breath work. We were talking about Wim Hof and stuff, and we, once a month or every other month, we do focused, intentional, conscious breathing to hyperoxygenate our bodies and teach people all those practices. So if you think you or a loved one might, benefit from this, go get checked out. For them to contact you? What's the best way to hey, I think I might, what's step A?
I mean, probably start with your primary physician and just get a sleep study. If you have a kid, the challenge with kids is unless you go to a doctor that's kind of clued in that space, they often will push it off. So Phoenix Children's Hospital, like the ear, nose, and throat department is a good place. If your kid is, not sleeping well, or if they breathe noisy, if your kid is breathing at night and they're a noisy breather or they're snoring, they absolutely need to get tested, without a doubt. I have one question for the group too.
Sure.
Since they were asking me questions. So I mentioned that I was this, nerdy guy that was grew up in this era, like they would never touch anything like an edible or whatever. My wife, on the other hand, is the opposite. She's like, hey, bring it, let's try this. So she was my setter when I did the thing in Sedona when I ate the mushrooms, but she's done what she called a heroic dose. I did like the wimpy dose, right? I wanted to still be in control because I didn't know what I was signing up for. But she told me, and I when she told me this, I rolled my eyes. I'm like, come on, that's silly. She's like, no, Sheldon, the mushrooms, it's like they're like intelligent. They knew what I needed to hear. I'm like, mushrooms don't have intelligence. They're plants. They're kingdom fungi. She goes, no, you're wrong. They do. And so I'm just curious to the group. Is this a common experience, or can I go home and tell her?
We're not going to go down that rabbit hole because that'll be like 7 people want to share 20-minute stories. But the short answer is multiple people in this room will tell you yes. So we'll leave it at that, just to wrap up, and then you can have some private conversations afterwards.
Okay.
And stuff,
Yeah,
so.
there's one thing I want to add to that.
Sure.
Even when you're not consuming the mushroom, there's already increasing scientific evidence that mushrooms actually do communicate, and trees communicate.
Yeah, I've read that before.
And this information is actually not that new.
Yeah.
Okay, there was a female scientist who was on the autistic spectrum, and she was, what do you call this? Asperger's.
Yeah.
And she actually made the connection that plants were communicating, especially trees, chemically, and they were actually communicating through their root system via
Like a neural network kind of thing.
via the mushrooms,
Yeah.
the mycelium.
Yeah. Go watch Fantastic Fungi. Learn all about
Yeah,
it.
there you go. Yeah,
Okay.
cool.
We'll wrap up here though. So just wanted to tell you guys about a couple of upcoming announcements. People who are in the recovery group in the room, are you guys meeting? Is that tomorrow night for everyone, or is that just Justin? Do you know, or Audrey?
For everyone.
Yeah. It's for everyone. Okay. So what's the details on it? 6 p.m. Location? What are we meeting at? recovery group. It's tomorrow night, right? I was going to making future announcements. So.
Oh, sorry, I thought we were having Carla speak on that. No.
Oh, I was just going to wrap it up in the next like 2 minutes here, real quick. So
It's 6
we
p.m.
can.
6 p.m.
6 p.m.
Where?
Pile Adult Center in Tempe.
6 p.m. Pile Adult Center, Tempe, tomorrow night. Recovery group, come on out. Friday night, we're going to have a movie night. We can come out and watch a movie together. It's going to be at my house in my backyard, so it will be cool out. You're going to be in the grass outside. It's getting cold out, so bring blankets, chairs, that kind of stuff. We're going to watch a movie called The Men Who Stare at Goats, so we will be the men and women who stare at men who stare at goats. So come on out.
I said goats or ghosts?
Goats.
Goats.
Yeah, it's a movie. We'll have concessions and stuff available for purchase there, for donation stuff. If you want to bring your own stuff, you're welcome to. And then, not this coming weekend, but the following weekend, I'm hosting a men's medicine retreat in Phoenix. So if that's something you or anyone you know is interested in, have them reach out to me. I'm happy to share more details on that. Any other announcements that we've got coming up? I think those were the three in the next week-ish, 2 weeks, something like that. Breathwork's coming up, yeah, a couple weekends, so towards the end of the month. Other than that, thank you again. Appreciate the information. If you got any questions, come chat afterwards. And appreciate all you guys. And have a good night, everyone.